This trips up a ton of people. I get people in my chair here in New Jersey all the time who say I want veneers, and then I take a look and what they actually need is an implant, or the other way around, and they look at me like I just told them their favorite show got canceled. So let me save you the confusion right now. Implants and veneers are not two versions of the same thing. They are not even in the same category. They solve completely different problems. And once you understand the difference, this whole thing gets a lot easier. Let us start with the big one. An implant is what you get when a tooth is actually missing or needs to come out. We place a small titanium post into your jaw where the root used to be. That post fuses with your bone over a few months, and then we put a custom crown on top. The end result is a brand new tooth that looks and works like the real thing. It is the closest thing we have to growing one back. Now, a veneer is a completely different story. A veneer is a thin shell of porcelain that we bond to the front of a tooth you already have. Notice what I just said, a tooth you already have. Veneers do not replace missing teeth, they make the teeth that are already there look fantastic. Chips, stains, gaps, teeth that are a little crooked or worn down, that is veneer territory. So already you can see these two are playing very different games. One rebuilds a tooth that is gone, the other beautifies a tooth that is staying. But here is the question everybody actually wants answered. Do they last? Here is what the science actually says. For implants, large reviews of long-term studies found survival rates around 95% after 10 years. That is a titanium post doing its job for a decade and beyond. Studies on porcelain veneers found 10-year survival rates in the ballpark of 95 to 96%. So both of these treatments are workhorses when they are done well and taken care of. Those are numbers from published research on the general public. That is not me making you a promise. Your results depend on your mouth, your habits, and how well you take care of things. So who is each one really for? If you are missing a tooth or you are about to lose one, an implant is usually the answer. Nothing else replaces a whole tooth root and all quite like it. If your teeth are all present and accounted for, but you are just not loving how they look, veneers might be your best friend. Chips, gaps, stubborn stains. A smile that has taken a few years of wear and tear. That is where veneers shine. Every mouth tells its own story, which is exactly why you cannot diagnose yourself from a video of a dentist talking. Even a likable one, and that is why this month I am offering a complimentary smile preview right here at Classic Dental Arts. You get a 3D scan, a computer simulation of what your new smile could look like, and some real one-on-one time with me. No pressure, no commitment, and no judgment about the flossing. If you have been putting off doing something about your smile, this is the easiest first step. Tap the link below or give us a call and come claim your complimentary smile preview. Worst case, you get to meet me. I am Dr. Spiros Karas, a general dentist here in Manalapan, New Jersey. Come say hello.